Welcome to Medical Marijuana and Wellness. My name is Marc Matoza. Today's topic is going to be getting started with medical cannabis, and we're going to talk about all the different things you need to know about dosing, terpenes, routes of administration, and more. Helping me today is Lisa Black. Lisa is with INSA, and she's a community educator. And Lisa, you have addressed a lot of these topics, haven't you?
We absolutely have. Here at INSA, we're all about education. And so we like to have lots of different events and forums for people to ask their questions and get comfortable on their cannabis journey.
Cool. So let's dive into that. What we want to do today is help you develop an understanding of cannabis as medicine. Then we also want to talk about medical marijuana programs, the clinics and dispensaries. What is a medical marijuana product? We want to define that for you. We're going to talk about what they call journaling or self-guided dosing. Very important because dosing is one of the two things that is really critical to having your journey with medical cannabis to relief of successful. And lastly, and not least, is helping you create practical application. I call it a regime, a program system, where on a daily basis, you know what to do in order to be able to get the relief with the products that you're looking for. So that being said, let's talk about what medical cannabis is. And there's some key components to it. Lisa, tell me a little bit about what makes up medical cannabis or what makes up cannabis in general.
Absolutely. So the first thing that really makes cannabis what it is are the cannabinoids. The cannabinoids are a lot like the active ingredients of cannabis. So if you go to the store and you buy yourself some cold medicine, they'll have the active ingredients and inactive ingredients. And it's those active ingredients that are, making you feel better. It's the same thing with cannabis. Those cannabinoids are the active ingredients that really make those typical cannabis effects, but they aren't the only component of cannabis that, changes the effect. The terpenes and the flavonoids also have a big effect on the different sort of personalities that different cannabis strains can have. And so, for instance, there's cannabis out there that can make you feel really energized and ready to tackle the day. And conversely, there's cannabis out there that can make you feel really relaxed and ready for bed. And it's the terpenes and, to a lesser extent, the flavonoids that are dictating those different personalities. So you really want to look
The
at
terpenes and the
all of those
flavonoids
things.
have been known to really bring the medical value to cannabis.
Absolutely, absolutely. And like I said, you hear about cannabis doing all these different things and all these different effects, and that's down to those terpenes and flavonoids.
Sure. Now, what's interesting is when they work together, cannabis, the cannabinoids, terpenes, and flavonoids, it creates something called the entourage effect. Can you explain that to me?
Sure. The entourage effect is basically stating that the whole is greater than the sum of its parts. Or how I really like how you explain it, Mark, where it's like 1 + 1 = 3. And so what that means is that all of these different compounds work together to make a stronger effect and increased efficacy than they would if we were to separate them. And so, for example, THC works better when there's a little bit of CBD, and CBD works best when there's a little bit of THC.
Mhm.
And both of those cannabinoids work better when there are terpenes present. There have been studies that have shown that the presence of terpenes can increase the efficiency of the cannabinoids in whatever product you're utilizing. So, all of these things work together to create a fully functional medicine.
Right. And this is what makes cannabis very fascinating because it's not a product, it's a combination of products or cannabinoids, terpenes, and flavonoids that bring you medical benefits. It's a plant that acts as a medicine. It is not a drug. And that's what's really, really important. And really to understand it, understand why it's important to us, is we found out when we were studying medical cannabis that every human being has what they call an endocannabinoid system. That endocannabinoid system is where you have their chemical signals that works with the receptors in your body to be able to trigger different reactions. For example, it helps you with learning, it helps you with memory, it helps you with emotional processing, eat and sleep, how temperature control, how hot you get, your immune system, inflammation, pain. This is cannabinoids, or the cannabinoid system is what controls all of that. And it does it through the CB1 and CB2 receptors. What are the difference between the CB1 and CB2 receptors, Lisa?
Well, CB1 and CB2 receptors you can think of as locks. So they're locks on the door of your body's function. And behind those two doors are various things that your body can do to bring that homeostasis or balance back to your body. And just like, any other lock in the world, they're not going to open with every key. They need a specific key. And the different cannabinoids connect with these different receptors to create these different effects on the body to bring that balance back.
Sure. And CB1 receptors are mainly found in the brain, the spinal cord, and a lot of your peripheral organs, where the CB2 receptors are fundamentally found in a lot of the your internal organs, your blood cells, your tonsils, your spleens, those types of things. So what's interesting is the CB1 receptors, because they're in the brain, they work very closely with THC, and that's where sometimes you can get that high effect coming into play. For CB2 receptors, although they work primarily with CBD, they do work with THC, but primarily with CBD, you really don't get that high effect from CBD because it's not addressing the brain; it's addressing a lot of the other parts of your body. And it's interesting how working together they provide a lot of medical benefits. Now, Lisa, what's fascinating is cannabis really ties back to what we call the endocannabinoid system, because these endocannabinoids are what your body produces to manage itself. But when you are endocannabinoid deficient, for example, I'm a senior citizen. I don't produce endocannabinoids like I did before. But if my body needs those endocannabinoids to address a particular issue, I now can use cannabis or phytocannabinoids to be able to provide my body the fundamental resources it needs to be able to address that particular problem. That's called homeostasis. It keeps your body in balance. And phytocannabinoids mimic and work very much like the endocannabinoids.
It's really fascinating. I often tell people that it's a lot like when you have a vitamin deficiency and you're taking a vitamin. It's helping supplement what your body needs. And that's what a lot of the cannabinoids do, is they're supplementing these internal cannabinoids that your body is already making and basically amplifying the entire system.
Yeah. And it's really interesting how it all works. And really, the CB1 and CB2 receptors work very well with both endocannabinoids and also phytocannabinoids. And really, that's how your body stays in balance. So I also want to point out there's been a lot of research on this. A lot of people say, well, is there science behind medical cannabis? And the answer is absolutely. This is an article from Harvard Health Publishing. There are hundreds, if not thousands, of articles published on medical cannabis. All I wanted to do is point out to you, this isn't something that's being done in a back room. There is a lot of studies now. They're not necessarily done here in the United States because we have a Schedule I drug in the United States called cannabis, which allows or prevents research from being done. But research has been done in Israel, in Europe, South Africa, all over the world. And in fact, right now, there's more research being done on medical cannabis just this year than has been done in all the previous years that are out there. So it's something that's well studied and something that we know about. I think in the United States, we need to get on the bandwagon to be able to really understand this product. Now,
Yeah, we've got some catching up to do.
yeah, and a lot of catching up to do. So the question is, what is in a medical marijuana product? And really, it's made up of 4 different things. Now, we have over here what they call a certificate of analysis. And Lisa, I'm going to have you explain that in a minute. But really, what we're talking about is routes of administration, or how do you use it? The type of product is the strain, the terpene, and the flavonoid. We call those cultivars. When they all 3 are put together to address a particular condition, like pain or inflammation, that's a cultivar. The potency is how strong it is, how much cannabis is in there, and also how much terpenes are in there. Again, this has to do with the medical benefit. But Lisa, for a moment, tell me, why are COAs important?
Well, COAs are really important because they make sure that the products that we're putting on the menu have reached all guidelines that the state have put forth. These are guidelines that include, purity, cleanliness, basically making sure that everything that should be in there is in there, and everything that should not be in there is not in there.
Right.
And so it'll analyze things such as potency, like THC and CBD. It'll analyze the terpene content, and it'll analyze the plant material or whatever product it is itself to make sure there are no, solvents or molds or really anything. The tests are quite extensive. And this is one of the things that really separates the medical dispensary from, black market, is that it's very highly regulated.
Right.
Whereas in the black market, that just doesn't happen. They don't have certificates of analysis. And so we're really proud of that at INSA, that we go, that full mile to make sure that our products are as safe as possible. And that certificate of analysis is just the way of confirming, yes, this is really safe for, our patients to use.
Yeah, and a lot of the states that put together medical marijuana programs want obviously the products to be safe, and licensed dispensaries like INSA have to come up with 2 internal tests that they have to submit before the product can be released, and also 1 test done by a third party firm. So you've got 3 tests on every product that's done. Is that correct?
Yep. And, that third party test, we don't have any part of, that whatsoever. That's a state approved lab. So, that's something that the state government has said, yes, this is a good lab. And then they're the ones who do all the testing. And it's not like there's any conflict of interest or anything like that. They're
Right.
just going to report what they find. And it's a very important step that dispensaries follow.
And as a medical marijuana patient, you can go into a dispensary and you can ask for a COA, or a certificate of analysis. They will give you that for every one of the products. And I highly recommend looking at them so you know what kind of product you're getting, and handily if it addresses your particular situation. Now let's jump.
Especially if you find a product that you really love, go
Mhm.
ahead and ask for that COA and learn everything about it that you can.
Yeah, because if for some reason it's not available, because again, these are botanical substances, and
Mhm.
it's like going to a grocery store that may be out of apples, that may be out that day, you can find other products that have the terpene profiles and some of the cannabinoids in there to really help address your particular situation. Now, before we jump into the cannabinoids and terpenes that can help you, let's talk a little bit about how you take it, because how you take it is really important. And there's a couple of things to pay attention to. Number one is something called onset time. Onset time says how long does it take to take effect. So, for example, in a sublingual drops are where you put an eyedropper underneath your tongue of cannabis, swish it around your mouth, or you just let it sit underneath your tongue, and in about 30 seconds, it'll be absorbed. It gets absorbed into the blood vessels. It takes anywhere between 15 to 20 minutes to work, and it'll work between 4 to 6 hours. The same goes for sprays. This is kind of interesting because this is where a lot of people start, is with sublingual.
It's true. It's a really easy way to dose. And, having a liquid medication is something that everyone is, more or less familiar with. We're all used to taking some cold medicine, like I said before, or something like that. And so having your medication in a familiar form is really comforting for a lot of people as they start something brand new like cannabis.
Right. And we'll talk a little bit about dosing, but sublingual is mainly where a lot of people, especially new patients, really start. Some of the most famous products are what we call oral products. These are your famous gummies, your brownies, your different edibles that are out there, as well as capsules. They can take anywhere between an hour to 2 hours to work. By the way, that's the same for edibles down here. It can take up to 2 hours for an edible to work, but they last anywhere from 4 to 10 hours. That's what makes them so great. For example, in the evening, I have herniated discs in my neck and I have pain and inflammation I'm going after. I need to be able to sleep through the night, hopefully get 8 hours of sleep. And if you look at the different routes of administration, oral is one of the few that give me more than 8 hours. It gives me 10 hours of sleep. But you've got to be very careful, because when you take that oral product, you take that gummy, you take that brownie, or take that chocolate bar, it's going to take a while. In fact, we have a saying that about the time you don't think it's working and you take another one is when it starts working. You've seen that a little bit, haven't you?
Oh, absolutely. And that's why we always tell people, start low and go slow. Emphasis on the slow.
Mhm.
We want you to start off with a nice low dose so you don't over medicate, and we want you to take your time. Because, like you said, if an hour's gone by and you're not feeling anything and you go ahead and take more, that's when all of it's going to hit you all at once. And it might not be the most comfortable experience. And so that's why we always emphasize, try to take as much time as you can before you have that next serving.
Yeah, don't rush gummies. I know that and the good news and the bad news is they're easy to take. The bad news is they taste too good. I know that the chocolates at INSA are outrageous. They're great, but don't take that second one until you're ready. Go low, start low and go slow. Others
Exactly.
is topicals. This is where you can actually have either a transdermal or just a topical where you put something on your skin. And topicals work fairly effectively. In fact, they work very quickly, almost immediately in the last a couple hours.
Yeah, they're really amazing. I think topicals are maybe an overlooked or underutilized medical cannabis product that are great for attacking local areas of discomfort. But one of the great things about topicals not transdermal patches, just topicals, is that there is no high associated. The way that your body absorbs the cannabinoids through a lotion or a salve is that it's going to keep all of those cannabinoids in that spot. It's not going to travel to your brain to make you feel high. And so topicals are an excellent option for when you need to be as clear-headed as possible, but you still need to reduce some pain or discomfort.
Now, transdermals actually go between the blood-brain barrier, get right into your bloodstream.
They do. They are specifically formulated to deposit the cannabinoids directly into your bloodstream. And so there is some possibility of some psychoactivity or mood elevation happening. But I will say that transdermal patches are usually formulated to deposit slow, low, steady amounts into the bloodstream. And so the psychoactive feelings that you get for them are usually really minimal.
Right. But
If at all.
topicals are very effective. I know sometimes my hands hurt just from just doing things during the day, and I use topicals to be able to help quite a bit. It works very, very effectively. Now, some of the most famous ways of using cannabis are what we call inhalation, smoking a blunt, looking at a vape pen, trying some concentrates. There's a lot of flower is a great way to take cannabis. However, from a medical cannabis standpoint, when you take that flower and you roll it into what they call a joint, and then you take that flame and you light that joint, take that 500-degree flame and light that joint, you're burning off about half of the cannabinoids, almost all of the terpenes and all the flavonoids. Although you're losing about 50 to 60% of the efficacy of the flower product itself, it still works. I mean, there's very few products that you can run at 40% and still have it work, but you're not getting the full potential of the product. And that's why if people want to smoke flower, I suggest dry herb vaporizers. Your thoughts on that, Lisa?
I think that's a great option, and you're completely right. You know, when you have the combustion, you are losing some of the potency. You are wasting some of the potential in that, plant material. But when you're vaporizing, what's happening is it's just heating the plant material to the point where the cannabinoids and terpenes get released into vapor. There's no actual burning that's happening. And I know people who really liked to vaporize their cannabis, and just to make sure that they got absolutely everything afterwards, they would smoke it. And after they vaporized it, the heat that was added to the flower basically converts a lot of the THC into a substance called CBN. Mm-hmm. And that makes it really great for right before bed, because CBN can make you feel really sleepy. And so they basically got double duty out of their cannabis because of that. They would vaporize it.
I know with the dry herb vaporizer that I use, what's left over, and by the way, a reason I like a dry herb vaporizer is there's no burnt materials getting into your lungs, so it's a lot safer than smoking a joint. But I'll take the material that's left over, and what I'll do is I also can put it in smoothies and in my coffee.
Yeah, that's great. I've known people who will take the leftover material and make tinctures. There's still a little bit in there, not a ton, because you've gotten a lot of it into the vapor, but there's still a little bit in there that you can utilize that you wouldn't be able to if you just combusted it.
And then, of course, you can, in a dispensary like INSA, you can buy the vape pens themselves, the actual vape pens. And I want to point out, these vape pens have been tested. They are safe.
Yes, tested numerous times. Not only tested the material that we put inside the cartridges, but tested after we put the concentrates inside the cartridges as well. So we send the housing, the whole unit, to be tested to make sure the whole thing is safe.
Right. And then by taking the flower and breaking it down into different components, for example, like the oils, they also break down into things like shatters, things like waxes. I'm not going to get too much into the different kinds of concentrates, but there's ways of taking that flower, putting it into a concentrate form, and then you're being able to smoke it with a vape pen that handles concentrates. And again, it's something that's very, very effective and also very cost effective.
It is. It absolutely is. And it's actually a really great way for those who have a little bit of experience with cannabis to medicate, because they are strong, they are potent, but sometimes it's nice to only take one puff and get the effects that you want and then move on with your day. And that's what those concentrate vaporizers really can provide.
Right. Something to really help you out. So there's different ways of taking cannabis. What you should look at is, especially if you're new to cannabis, or even if you've been around for a while, there are different options that you have. And by the way, there's no one that's better than the other. It really is something as, what do you prefer, what works for you, and candidly, what you're comfortable with. I think that's how you choose which way you're going there. Now, one of the other things that is critical, probably the two things that are critical about cannabis, one of the two things is the terpenes. When your body is working with cannabis, the cannabinoids, think of it like opening up a flower, works with the receptor, opens up the receptor. What gets deposited are the terpenes and the flavonoids. Each terpene has a different component and works for something that's very different. These are kind of the top six that are out there. Tell us a little bit about terpenes.
Well, terpenes are the essential oils of cannabis that give it its distinct smell and flavor as well. But beyond that, they do have the different effects that you can see here on the screen. And so sometimes people ask us, why does some cannabis make me feel really energized and some cannabis makes me feel really sleepy when it has the same THC amount? Well, that's because of the different terpene content or the different terpene profiles, is often what we'll say.
Right.
And so the different combinations of these different primary terpenes are going to have different effects. So
Mm-hmm.
if you have something, for instance, that's really high in limonene and pinene, that is going to get you going most likely. Be a really great daytime strain for tackling your
Get
to-do
you
list.
energized, right?
Exactly. And if you want to maybe relax at the end of the day, something that's really strong and something like linalool is going
Mm-hmm.
to be perfect. That's the same stuff that's found in lavender. And as most people know, lavender is really great for soothing and relaxing both the body and the mind. And
Mm-hmm.
so it's these different components that put together make those different personalities that different cannabis strains can have.
Right.
And once you figure out what terpenes you best respond to, you can sort of ignore the names and cultivars and just look at their terpene content. And that's going to be a great way for you to find new strains that are going to work for you if your favorite isn't in stock.
Right. I tend to look at terpene profiles more than strains because the terpene profiles provide the medical benefits. And again, in my case, I'm trying to manage pain, I'm trying to manage inflammation. And I found that if I pay attention to terpenes that are in the cannabis products that I'm buying, really makes a big difference. Some of the famous ones, for example, for medical cannabis are the myrcene and the beta caryophyllene or caryophyllene.
Yeah, those are critical terpenes for sure. The myrcene is important because that is the most common terpene in cannabis. It is far and away the most prominent terpene. I have yet to see cannabis that doesn't have any myrcene
Mm-hmm.
in it whatsoever.
Yeah.
And one thing that is hypothesized about myrcene specifically is that it may be a big reason that the entourage effect exists.
Right.
And so there might be something specifically about myrcene that preps the body to allow us to absorb those cannabinoids more efficiently.
Uh-huh.
And that's definitely going to change the effects of the strain that you're feeling.
Sure.
Um, Caryophyllene is one of my favorite terpenes because they've recently found a couple years ago that it actually binds to the endocannabinoid system like a cannabinoid does. And so I like to think of it as a bonus cannabinoid. And it binds to the CB2 receptor, which is
Mm-hmm.
the same one that CBD does. And so it actually has a lot in common with CBD, perhaps unsurprisingly. So that one's excellent for anti-inflammation and for pain relief for that reason, and also
Yeah, I was
anxiety.
going to say it's a go-to terpene for pain relief, and also for if you combine it with linalool or you combine it with myrcene, it's great for anxiety and stress as well.
For sure. I treat for anxiety that manifests into nausea, and
Mm-hmm.
my top three are the limonene, linalool, and caryophyllene, just for that reason. The limonene helps me with the nausea, and the linalool and the caryophyllene helps with the anxiety.
Right. And I should point out there's over 200 different terpenes that we've been able to identify. We're studying about 120 of them. But in reality, we've only really done extensive study on about 20 of them because, again, this is a new area of research in the medical field. I do want to point out there's one that's really not talked about a lot, but I really like, and that's why it's on the chart, and that's eucalyptol. Eucalyptol is great for decreasing blood pressure. It's also great to be able to help people with dementia and also with sinus infections. Eucalyptol is kind of the secret little terpene that can help with a lot of different medical conditions.
It can, it definitely can.
Yeah, and
And it
it's
has a
found
nice
in
taste too.
yeah, and it's found in a number of different cannabinoids. But these are the main ones, as I mentioned. There's over 120 of them that they're studying. There are bigger charts, but when you go to a dispensary and you say, "I have this particular condition," they'll recommend some products, and you'll say to yourself, "How do they know what products to recommend?" It's because they look at the terpene profile, and they match the relief you're looking for to the terpene profile, and that tells them the products you should be using and leads to the strains that are there. It's kind of the process that you go through. Now, let's talk about a particular product. Lisa, this is your apples and banana product. Why don't you walk me through this, because we're going to go through how each of these works. Route of administration
Absolutely.
is, in this case, it's a vape cartridge.
Yeah, so route of administration, this would be an inhalation method because you're just going to draw on that cartridge and inhale the subsequent vapor. Uh, and we do suggest that if you're newer to vaporizers and concentrates in general, to just take a puff or two. That's usually all you need. The product type, it's considered a concentrate, but also a hybrid. And the hybrid is basically, sativa, hybrid, and indica is kind of the model that a lot of people are used to. And it's kind of a reference point that people really understand. And so we still utilize those terms, but we utilize them while looking at the terpene content. And
Mhm.
so we look at that terpene content of our apples and bananas strain. We realize it's got a really good mix of, those energizing terpenes and those relaxing terpenes. We're going to classify it as a hybrid, something that's not necessarily going to bring you up too high or bring you down too low.
Yeah.
Now, when it comes to potency, that's referring to the amount of THC or CBD inside of that particular product. And so how much of those active ingredients, those active cannabinoids, are inside that product.
And there are
And
more
then
cannabinoids than CBD and THC. That's where you see the CBCs, the CBNs, that type of thing.
For sure. And I would say of these, probably the one that you're going to see most often after THC and CBD is CBN. CBN is getting a lot of attention right now because it's being used a lot in sleep products. And sleep is one of the most common reasons why people use cannabis. So if you
And
see
it's also
CBN, it's probably a sleepy product.
it's also very relaxing. A lot of people just want to de-stress during the day. Find it's very, very helpful. And also, the one thing I like about this, notice this says this is a resin cartridge. Resin just has to do with how it's made. How it's made is it keeps almost all the terpenes and cannabinoids in the product as they're making it, and it gives you a very high terpene content because of that. It's called whole plant. And you look at this one with the beta myrcene, beta caryophyllene. This is really good for, again, inflammation and pain.
Yes. And ocimene, one of my favorite terpenes, has that nice citrusy feel. And so that's where you're going to get a tiny bit of a boost. And so
Mhm.
really well balanced across those top three terpenes there.
And I should point out these terpene levels don't look like they're very high as far as a percentage compared to the active cannabinoids, but terpenes are very, very strong. They're very powerful. A little bit goes a long way, and that's why you find these lower concentrations here, because really they're bringing on that medical value. And this is an example of a particular product. You can go through this on any product that you take a look at. We just happen to pick this one as an example today. Now, let's talk about a little bit about medical cannabis programs, because we're part of it. I'm going to use Florida as an example, but I can tell you that whether you're in Massachusetts, whether you're in Mississippi, uh, other states, they have very similar programs. A little bit different in the implementation, but I would say about 90%, 95% are most all the same. Where you have the question is, how do you qualify? What are the qualifying conditions? How much can you possess? These are all just programs that you'll find, or uh, constraints that the state has put on to allow you to be able to use medical cannabis. Now, in many cases, if you're not from the state of Florida, here's a link down here that you can go to, and you can find out in your state what your different programs are and how they work. But pay attention to these, because this will tell you how you can use medical cannabis in the state that you're in. And every state has their own set of rules and regulations. And that also goes for dispensaries. In the case of dispensaries, they have their own rules and regulations. The state will have specific rules and regulations. One of them, as I mentioned before, is rigorous testing. I think, Elisa, you go through quite a bit of, let's just say, state procedures to make sure your products are safe.
Oh, absolutely. And honestly, we would follow these procedures even if they weren't state regulated, just because we really do care about our products and the patients that are going to be utilizing them. But following these regulations ensures that the products that we are creating are safe for use. And so, yep, we go through a lot of hoops to make sure that we're following all those regulations, but every single one of them is worth it.
Yeah, and I hear a lot of people say, well, listen, I know, why don't we just use a street product? Street product might be cheaper because they don't have to pay for the testing. But on the other side of the coin, where you hear about all the problems related to medical cannabis, it has to do with untested products. As long as you have a tested product, you're in good shape. And no one has ever died from use of cannabis. You may get a little high, you may be uncomfortable, but it's not going to cause death like opioids or heroin or alcohol or
Mhm.
things like that. This is a fairly safe product to be able to be used. And again, the dispensaries make sure that it's safe by doing the testing that's there.
Yeah, it's
Now,
pretty
one of the,
wild. Fun fact I love to say is that it's actually easier to overdose on water than it is on cannabis.
that's true. That is true. Um, Now, one of the other parts, besides getting your terpenes correct, to know the terpenes that address your particular condition that you're looking for, how do I get the relief? Here's the terpenes that help me. It's also taking the right amount of it. And I should point out that cannabis, like any other product, is really dependent on your body as to how much you use and where you use. We have a thing called a therapeutic dose. In other words, what is that? I should point out that if you're drinking coffee, you're taking alcohol. Some people have different tolerance levels. I have friends that can take one drink and they're done for the night, and I have other friends that drink a bottle and they're just getting started. The same is true for any product, whether it comes from a pharma company or from cannabis. You've got to understand what your body's tolerance is. In many cases, when a doctor is prescribing those, take 2 pills and call me in the morning, those pills are what they call the minimum lowest dosing level. Starts a patient out here to find out where, in fact, the product really works. The nice part about cannabis is you don't need to go back to the doctor and ask him for how much more you should be taking. You can start off with, let's say, an eighth of that eyedropper of cannabis, then go up to a quarter of an eyedropper. Try that for a day or two. You be able to start low and go slow. A day or two later, try it a little bit more. Eventually, you're going to build up to a point where your body, I'm going to point out, your body will feel the relief that you're looking for. Your body will tell you when it's working. I know in my particular case, I had 7 herniated discs in my neck, which is instant pain. And when I began to get relief and I began to feel better, my body told me. I knew I was feeling better. I didn't need a doctor to tell me. Now, what happens is if you keep going, you keep adding a little bit more and a little bit more. What'll happen is cannabis is what they call biphasic. Now, biphasic means that it can actually bring back a lot of those negative effects that you really want. Tell us a little bit about that, Lisa, and also about how do you avoid getting into this toxic range over here where you're taking a little bit too much? And if you do, what do you do?
Yeah, so that's why we have that whole catchphrase of starting low and going slow. You want to start with that low dose and gradually, slowly increase until you're getting the effects that you want. And once you find that optimal dose, then you can sort of hover there and stay with that routine for a while. Over time, you may have to change a little thing here or there, but you want to stay in that middle range. If you start to, for instance, the edibles, perfect example. If you are taking a couple and you're not feeling anything, and then you have a little bit too much, that's when you're going to start going into that toxic range where you're maybe not feeling your pain as much, but you're also feeling too inebriated and you're feeling uncomfortable. That's not tolerating your medicine well. We
Right.
don't want you to feel uncomfortable while you're medicating. And so finding that target range, finding that, happy medium is really important, but it's not necessarily going to happen right away. So if you find that you need to take a puff and then another puff and oh geez, 3 puffs, that's okay. It's your body. It's whatever you are responding to.
Now, a lot of people will say, how much should I take? I get the famous question of what should I take? The answer is I can't answer that question because every person's body is different. Start low, go slow, and listen to your body. Your body will tell you when it's beginning to feel better. Take it for a day or two at a certain level, like with the tincture drops, take a quarter of an eyedropper, then maybe go to a half an eyedropper. And if that's not working, then take it once in the morning and once in the evenings. Just go low and go slow. Eventually, your body is going to feel the relief that you're looking for. And if you take a little bit too much, you feel a little bit uncomfortable. You're not necessarily in that real comfort range, and you'll be able to go back to that level. And that's what they call your therapeutic dosing level. And in many cases, that's your tolerance to THC. So once you understand your tolerance to THC, you can actually add a little bit more cannabinoid, CBD. This gets you what they call a ratioed product. You've heard about ratios like 4-to-1, 3-to-1, 8-to-1, 1-to-8. The first one is how much CBD is in it. The second is how much THC is in it. And when you understand your tolerance to THC, you can increase the amount of CBD to be able to really help get you the effects that you want. My wife worries about anxiety and stress, and what she does is she has a product that she takes. It's 12 CBD, to 1 THC. She's very sensitive to THC, but we've been able to figure out what her sensitivity range is, and then add enough cannabis CBD to it to really provide the relief that's really there. A lot of people go through that, Lisa, don't they?
Absolutely. And so, sometimes it takes a little bit of time. That's why we say it's a cannabis journey.
Mhm.
It might take a little bit of time to find the perfect product that works well for your body and what works well for your lifestyle. But that's kind of the double-edged sword when it comes to cannabis. Yes, there's so many different ways to try it, and there's so many different ratios that it may take a while to find what works best for you. But because there are so many different ways to utilize it, and because there are so many different options, the odds are that there is a product out there that will be right for you and that will fit your lifestyle and will fit your tolerance.
And when you say take a while, you're talking about a week or two, maybe a month
Oh
of
yeah,
different
not that long,
fermentation.
not
You're not
not
talking
not
about four
months or
months.
anything like that. You know, I mean, like it might take a couple weeks to
Right.
figure it out for sure.
Right. It's really there. And again, you're controlling this. You're controlling what's there and how it actually works. Now, the question is, how do I know? How do I keep track? And I found that the best way to do that is with a journal. Now, there are two different journals. As a follow up to this, you'll see a link in the description below in the YouTube channel, and you can actually download one of two different journals. This one is from the Medical Marijuana Treatment Clinics that lets you track. You can go and each day keep track of the product you used, how did you use it, and how much. Same thing, INSA, you also have a tracking guide. A lot of people say, well, why do I need a journal? A lot of that has to do with you can keep track, you can actually see the trends, and it really tells you really where your therapeutic dosing level is.
Absolutely. And sometimes, you may feel really good up front, but after an hour, you might feel a little too sedated or a little too tired, and you
Mhm.
might not want that. And so that would be something you would write as a note. And then when you do find a product that you like, you can write down what was so beneficial about it, take it to your retail associate when you go to the dispensary, and they might be able to give you different options
Right,
and refine it down even further so
right.
that you've got your routine down to a science that works absolutely perfectly for you with multiple different products that you're utilizing. I know that you, Mark, you utilize different products during the day versus at night.
Yes, yes.
And having a journal like this will help you realize what products are good for when.
Journaling is what told me what products to use because I could see the effect that it had on my body at different times of the day. And also, I also found that cannabis loves what I call food. It loves fats. Taking cannabis on right after you've eaten or eat right after you take cannabis is a lot better than on an empty stomach.
Yeah, especially for edibles and tinctures as well. If you're using an edible or a tincture, having a little bit of food, especially something fatty, it's a great idea because THC and CBD like to grab onto those fat molecules, and that allows our body to process it more efficiently. So that's a
Right,
great idea.
right. So let's talk a little bit here. Let's talk. And so again, down below here, you'll see a link, and we'll have this again in the description below of different. You can take a look at you can download the different forms and also talks about how to dose. There's a patient information guide that it actually leads you to help you figure that out. So putting it all together, what we have found, let's apply our knowledge here. Your wellness depends on your symptoms and the preferences that you like. You're able to choose this, which is really great. You can try different things and find out what works. It also has to do with the route of administration, the potency, the environment that you're in. I know, for example, during the day, in the morning, I want something that's more uplifting. I don't need to be relaxed. I don't need something that sedates me. But in the evening, obviously, to go to bed and get some sleep, I definitely want to do that. And also, you mentioned medical cannabis can be used in conjunction with traditional medicine.
Absolutely. So if there's a traditional medicine that's still working for you for some other symptoms, then most likely cannabis can help supplement it, and there shouldn't be really any negatives to that. I will just say, definitely talk to your physician before mixing cannabis with any sort of prescription or medicine, just to be sure. You know, they are the medical professionals and they do understand drug interactions on a deeper level than a retail associate at a dispensary will. So definitely go to them with those sort of
Sure.
questions.
And so the question becomes, where do I go from here? I've got my medical cannabis card. I know I want to get rid of a particular, I want to address a particular situation. In my case, it's inflammation and pain. So what's my next steps? And let's lay out a few next steps. You need to create what I call a regime. A regime is a routine that you go through on a daily basis where you categorize the symptoms and conditions that you have, understand the different treatment parameters, the applications, and the routines that are there. And that really goes through really a process that we follow. And it's called STAR, STAR, symptoms, treatment parameters, applications, and routines. Um, I think, Lisa, it's very important that you can identify the symptoms that you really want to go after. And in many cases, you want to go after the actual symptom itself, and not something that's a secondary condition.
Yeah, absolutely. And I will say just the most common conditions that we do see people come in for
Mhm.
are pain, sleep, and anxiety and depression. And so those are the really most common reasons why people would come in to use cannabis, but there are so many different reasons why cannabis can help you. So for instance, I use it for nausea.
Mhm.
And so, you know, depending on what condition you're trying to treat, it's going to probably influence what products you should try.
Right, and that's very important. Identify what you're trying to go after. When you take a look at treatment parameters, the question comes up is, do you need relief? And the question is, for how long? This is kind of important because it has to do with things like falling asleep. If you want to fall asleep, you need to have products that be able to help that, but you really don't want to use those during in the mornings. Is that safe to say?
It's very safe to say. And yeah, we definitely we train all our associates to ask that question, especially when it comes to sleep. You know, some people have the trouble falling asleep, some people have the trouble staying asleep, some people have trouble with both.
Sure.
And depending on what is, you know, your biggest problem, then we may be recommending a different product for you. It might be a tincture to help you fall asleep and then an edible to help keep you asleep.
Right.
And so that's definitely going to be a factor.
Yeah, and I know in my particular case, I have herniated discs in my neck. They're not going to go away during the day. And so when I take a look at what are my options, I need to pay attention to using a product in the morning, like a tincture drop. If I use it in the morning, let's say I use it at 8 o'clock in the morning, by about 12, 2 o'clock, it's kind of worn off. In other words, it's a 4 to 6 hour duration. So what I need to do is I need to look at something in the afternoon to take me into the early evening, something in the early evening to take me through the night, and candidly, something to take me through the night. So this is where I have things where I'm using cannabis 2 or 3 times a day, but I'm using different types of cannabis. I'm using tincture drops. I'm using vapes. I may use a concentrate, for example, and I may use an edible, which is really great. I'm a chocoholic. Okay, so I'm guilty as charged. But this has to do with the application that's in here. Know how your body reacts to the CBDs and THC.
Definitely. And I know personally, I will have a like daily routine that will usually work just fine. But I also have certain products that are, I think of them as break glass in case of emergency. And
Mhm.
so I know if I'm having a day where I'm having like a panic attack or something like that, there are products that I will utilize in those next level situations as well.
Sure. And then last but not least is to come up with the routine. What are you going to do when you wake up? What are you going to do at the middle of the day? What are you going to do in the evenings? If you have something like anxiety and stress and you take cannabis and it gets rid of it, then you got rid of it. That's cool. But in my particular case, I have herniated discs. They're not going to go away. I mean, I wish they would, but unfortunately they're not. So I've got to pay attention to making sure that I'm doing something to address them as they go through the day. And that's what comes into play. I'm going to do something. What do I do when I wake up? And in my particular case, I'll wake up sometimes in a level of pain of a 7 or an 8. So I have a vape pen. I take an immediate hit, 1 or 2 hits off the vape pen. What that does, it works immediately and it drops my level of pain from a 7 or an 8, literally down to a 3 or less, down to a 1. And the first time that happens, you just kind of go, wow, I wonder what's happening. It's like
It's really
somebody
incredible.
took a rag and wiped my back and the pain went away, but it really works. But then after that, I have to follow it up with a tincture drop because it'll only last for about an hour or two, and I got to make sure it takes me through the morning. I've also got to take products to make sure that I'm awake because I have businesses to run. I have seminars like this or webinars like this to do. So I've got to make sure that I have the right product that keeps me there. One of the other things that people tend to do also is they do what they call microdosing, much like athletes that they eat a little bit of food during the day. The same thing applies to cannabis. You can take just a little bit, a little dose during the day, and it really helps you throughout the day to be able to, again, get a regime that'll help you through the entire day and through the evening.
Absolutely. I know, for instance, we have products that are specifically for microdosing. Tinctures are really great for microdosing because you can really bring the milligram amount down very low. But also, those gummies that a lot of people love, those are great for microdosing. They
Sure.
tend to only be 5 milligrams each, which is a really easy to tolerate dosage for most people. And so instead of having like 20 milligrams every, 3 hours, they'll just take one gummy every hour. And that is enough to maintain the effects that they're looking to, mitigate whatever symptoms they're looking to get rid of.
And again, if you are very tolerant, if you're very sensitive to THC, you can take that gummy and cut it in half.
Absolutely. Cut it in quarters if you want to.
Right.
Whatever is going to make you feel more comfortable, it's your medication and your body. Utilize it in whatever way is going to work best for you.
And as I mentioned before, eating with food really, really helps quite a bit.
Good idea.
So the key is find a route of administration and the timing that works for you. That's what's really, really key. Don't do anything. Don't try funky things. You always have friends who say, "Did you try this? Did you try that?" Use what, just use what you'll try. If you like tinctures, great. If you don't like tinctures, don't use them. If you like to smoke, great. And a lot of people don't. A lot of people prefer other methods of administration. Don't overlook topicals. Don't overlook edibles. They really work. It's really, really out there. But really pay attention to the regime that's really going to help you quite a bit. I'm going to take a quick example of this. We have patient A. They have arthritis, neuropathy, pain in the joints. They have mobility issues. The biggest problem they have is they really have trouble just getting or moving around. They want to do something that lets them go to work without feeling high, and also something that helps them without getting vertigo. So an example of this, here again, we go with the product type, the terpenes. Lisa, once you walk through this, this is where your symptoms, your parameters, your application, and routines all come into play.
Absolutely. So if I'm looking at patient A here, first I would definitely ask them what their preference of use would be. So if they're comfortable inhaling something or not. Since they don't have a preference on here, I'm going to go ahead and say, yeah, they are. Symptoms and conditions: joint pain, trouble sleeping with pain and vertigo, chronic arthritis, and neuropathy. So there are a couple different product types that I can see right off the bat would probably be beneficial for this patient.
Mhm.
First thing that they're probably going to want is something that will almost immediately take effect. And that's going to be an inhalation method. So perhaps some low level, low THC flower, since they're new, something with CBD in there would be best even, or even a 1-to-1 ratio vaporizer might be a good inhalation method for them to start off for that immediate pain relief. Like you said, you wake up in the morning, you're hit with that pain. You don't necessarily want to wait an hour and a half for that edible to kick in. So that inhalation method is really awesome for that.
Mhm.
If this patient, for whatever reason, doesn't like inhalation methods, then I would say a tincture first thing in the morning would be their best bet.
Yeah. And
Um,
I use a vape pen to get the pain down, and I use tinctures
mhm.
to take me through the rest of the morning.
Yep, absolutely. And I think that's a really smart and really common route of administration and scheduling of products. And
Yeah.
so during the
Then around
day,
noon, I look at gummies and edibles because again, they may take 2 hours of work, but it'll take me from 2 o'clock to 6 or 7 o'clock with that particular product. If I stick to, like you mentioned, a 5 milligram gummy, not a 20 milligram gummy.
exactly. And that's what I would say here. They want to have that symptom relief throughout the day, but they don't want to necessarily feel high or inebriated while they're doing what they're doing. And so I would ask this person to start off with a 1-to-1 ratio edible. What's great about those one-to-one, they have an even amount of CBD to THC. The CBD is always listed first. It's alphabetical, in case you're wondering. And having that balance of CBD to THC is going to be a really great way to prevent that inebriation that THC can sometimes provide, while also adding another aspect of inflammation relief. So that's where I would start off with. Maybe a one-to-one inhalable to start off the day to get rid of that pain to start off. And then throughout the day, microdosing with a one-to-one edible would probably be a good place to start. Now, I say a good place to start because it might change. That person might find that they're responding really well to THC, so they might go and move to a full THC product.
Now, before you get confused, we've went over a lot of things. One of the things that you can do as a patient is you can go to your local dispensary like INSA and you can ask them for a consultation.
Oh, yes. And you can even ask us that before you become technically a medical patient, and we'll still talk to you about what products we think might work best for you. And if you don't feel comfortable going into one of our stores, maybe you don't want to make the trip, or you have mobility issues, then you can always go to our website, INSA.com, and you can chat with someone live, a real person, from 9 a.m. to 7 p.m. every day. And so they are also trained to answer any questions that you may have that are product related, schedule or dosing related. And so they would be able to help you as well.
Yeah. And this is important. You're not alone. Sometimes when you start this, you wonder, well, how do I get a hold of my medical marijuana doctor? Well, hopefully he has a call center that you can call there and put you in touch with medical professionals that can help you with your particular question. Don't necessarily need to talk to the doctor themselves. They can get the questions answered, or you can also go to a dispensary and candidly do both. If you're confused about what to use and you're trying to figure out what to use, there are people that are professionals that are available to help you. And I think that's the key to medical cannabis. You don't necessarily need a doctor. If you listen to your body will tell you what works. How does your body know it works? Because you're consulting with some folks that can lead you to the right terpenes and dosing profiles that really fit what you're doing.
Absolutely.
So we've covered a lot of information, Lisa, and I know for a new patient, this is like drinking water out of a fire hose. But I do think that it's important that you get a lot of information. Again, in this YouTube video, you're going to also be able to get references to a number of the different charts, the dosing guides, and that type of thing. There's also resources you can look at. If you want to get a medical marijuana card, the medical marijuana treatment clinics of Florida are a company that provides cards, not just in Florida. They also provide cards in states like Mississippi, and states like Ohio, and are branching out into other states. We'll probably be at about 5 or 6 other states by the early next year. Other issue that comes up is when you're taking products, it's important to have CBD with you because it's a rescue product. In other words, it rescues you if you're getting a little high or feeling uncomfortable. Take some CBD and it'll bring you back to where your normal state. But a lot of the dispensaries don't sell hemp-based CBD because they're licensed to sell medical marijuana. So we came up for our patients with an online site called My Botanical Wellness, which follows that same high quality standards of testing and also is physician recommended products to be able to help you there. And naturally, looking at a medical marijuana product, Lisa, INSA is a pretty good place to start. Is that correct?
I have to say so.
And you're in a number of states as well.
Yeah, we have locations right now in Massachusetts and Florida and Ohio. And we're looking to expand even further, specifically Connecticut, which is really exciting. Have another New England-based location. But we've been around for, 6 years now. And ever since the beginning, and I've been with us since the beginning, we have been education focused. And so, some dispensaries, it might feel like they don't want to necessarily go as in depth with you. We've had a lot of people say that they feel like other dispensaries have a get you in, get you out kind of feel. Right. That is the exact opposite of the kind of experience we are cultivating. So we want you to ask as many questions as you have to feel comfortable with the product that you're purchasing, or not purchasing. Come see us, ask us as many questions as you like. If you go to INSA.com and you put in your zip code, it'll let you know the store that's closest to you. And we have some really great new patient deals as well to save you some money.
There you go. Yeah, and I know you do a great job of discounting. And of course, I'm going to mention we have the Marijuana Aware Patient Education, the YouTube channel of Marijuana Aware. We have not only information about resources like this, how to get started. We have webinars or videos on terpenes, cannabinoids, and also how it affects a number of different conditions: anxiety and stress, pain, cancer, epilepsy, a lot of different videos that are out there. Go check out the channel, because if you're looking for what terpene should I use, what stress, what cultivar should I use, what routes of administration, all those questions, you get answered through that YouTube channel. So Lisa, we covered a lot of information, and hopefully if we just help one person get their life back and get the relief they're looking for, we've accomplished what we wanted to accomplish. But any final thoughts?
Let's see. I would just say that, cannabis is nothing to be afraid of. If you do have some fear or concerns around it, just keep educating yourself. Education is going to provide you with those answers you're looking for, and hopefully the comfort to try cannabis for the first time.
Sure. And again, don't be afraid of it. There are people that you can ask questions to. You can ask questions to your dispensaries, just like you go to a pharmacy and talk to your pharmacy about the drugs that have been prescribed by your doctor. You can do exactly the same thing with your dispensaries. And in fact, they'll give you more information than a dispensary, right, than your pharmacy, because they'll actually help you choose the exact products that you want to use. I say exact products, meaning the right terpenes, the right route of administration, and the right dosing that's really out there that helps quite a bit. Listen, I want to thank everybody for watching this video. Like I mentioned, if we just help one person get their life back, then we think that we've accomplished what we wanted to accomplish. And thank you very much for joining us. And Lisa, thank you very much for helping me out.
Pleasure as always. Thank you for having me.
Great. Thank you. Have a good day.